Dear friends, welcome to the show Talk with Your Doc. I am Dr. Prashant Jani, and with us today is Jason Taddeo. He is a physiotherapist here in Thunder Bay. Today we are going to talk about concussion, which is an impact or trauma to the head, and it is very common in sports related injury. The number of cases of concussion have been doubled over the period of last 10 years. And concussion, if left undetected, can lead to long-term damage to the brain, and repeated concussion can prove fatal to the patient. Hence, it is very important to diagnose concussion, to treat it, and to prevent it. And Jason Taddeo, who is specialist in concussion, is going to guide us about the same. Thank you, Jason, for coming to the show.
Thank you for having me.
Please tell me, what is concussion?
Well, essentially concussion it's analogous to a mild traumatic brain injury. It's been defined very differently over the years in the literature, so how we refer to a concussion now is very different than how we referred to it, say, even 10 years ago, which may speak to one reason why the statistics for increasing diagnosis of concussion, there is a higher incidence now. With newer methods, we are starting to learn that certain patients that we didn't feel that were concussed previously actually did have a concussion. So this does influence the statistics.
So what is concussion according to new method?
So according to new research, concussion essentially is any type of trauma-induced disruption, whether it's a physical or cognitive result to the body due to damage to the brain. That damage may be immediately presenting in the patient. They may have signs and symptoms, or those signs and symptoms may be somewhat delayed by days or even weeks after the injury.
So what type of sports or what type of injuries can cause concussion?
Well, traditionally it's been thought that more higher impact sports such as football, rugby, etc., hockey, tend to see higher instances of concussion. However, that's been with the previous literature that has looked more at impact type of injuries. We now know that a concussion can occur without actually having an impact or direct blow to the head. This not only occurs in sport, but also in industry, motor vehicles, and just a slip and fall.
Can you explain that a little bit more? Concussion without high impact.
So concussion with high impact, essentially because of how the nervous system is housed. A direct blow to the head is not needed in order to create damage. So if we think of the brain as simple as a jello mold sitting on a table, that jello mold is sitting in a container slightly larger than it. If someone were to come and jostle or forcibly shove the table, for every action there's an equal and opposite reaction. That mold will actually move in one direction in response to the force and then recoil in the other direction, often creating injury to that jello mold or to that brain. Because it's housed in a slightly larger container, it can also impact the container being the head. So we often will see a coup contra coup injury where you see an injury to the tissue of the brain because of the actual shearing force or trauma, or the impact of the brain on the skull.
So this can happen in, say, motor vehicle, like you are traveling and sudden brake or jerk is applied. Is that what can cause?
That's right, and that often occurs without direct impact of the head.
Okay.
Some will assume that a concussion will only occur if you hit your head, say, on the steering wheel, but as simple as a whiplash where the head will forcibly go in one direction followed by recoil in the other direction. A slip and fall where you were to catch yourself or to land on the ground even though you didn't hit your head. A non-impact sport where you suffered a fall. All of these can cause concussion even without a direct trauma to the head.
So what happens? How does the patient present, or what do they feel like? How can one diagnose concussion? What are symptoms?
Sometimes patients don't present at all with symptoms. Other times, the first few minutes after an injury, they may simply feel off. They may feel foggy. The term in sports is sometimes having your bell rung. They may feel like that something has occurred, but they didn't know what, and they didn't feel it was too serious. Those patients may go on within hours to days later and feel nothing of the original injury. Other patients may experience onset of symptoms days to weeks afterwards. And those symptoms vary, and that's what makes diagnosing concussion very difficult in some cases. They often involve a combination of physical changes, such as issues with balance, motor control, dizziness, sensory changes, such as change in vision, ringing in your ears, called tinnitus, or you may see cognitive changes. The patient may feel that they're thinking differently, they're thinking slower. It's difficult for them to respond. There may be a period of temporary and minor amnesia, something that's off. And often patients don't realize it. It's usually those around them that notice subtle changes after concussion to their personality, their behavior.
So if somebody, say, high impact injury and he gets this symptom, then it's easy for him to know that it has been caused by the impact. But somebody who has non-impact type of concussion, how would they come to know?
Again, often there's immediately a period where they did feel something was different. They felt that there was some sort of dizziness, or they had some sort of, say, a headache that presented immediately afterwards. But then it's the collection of symptoms that either they feel within days to weeks after, or that may be observed by others around them.
So they go to their family doctor, or is there any specialist they have to go?
So family doctor is always the gatekeeper to access of care. So there are concussion specialists and programs in the community that are available for care. Patients that are often suspected with concussion will present to emerge. This often happens immediately after sport or after motor vehicle accidents. So often we do see a high frequency of cases going through the emergency department.
Okay.
But it's usually the family doctor, nurse practitioner, and primary care practitioners such as physiotherapists, chiropractors, that might also be the first to actually see that patient post-concussed.
So suppose in a sport somebody gets a concussion, should they go to emerge right away, or?
If there's a suspicion of concussion, yes. Particularly in sport, because some athletes have been concussed before. And as you mentioned, there's increasing literature and danger with repeated concussions. And this is very, very important, especially in adolescents. We've often seen cases where someone has become concussed, they have not sought care, they've returned to sport too soon, and they've suffered another concussion, often with permanent or even life-threatening consequences.
So they should go immediately to the doctor or emergency?
Or someone, absolutely, someone trained in concussion assessment.
Right.
And concussion assessment immediately involves essentially a very simple checklist of signs and symptoms that the patient may be presenting with or experienced, some physical examination, and some cognitive tasks that can actually be done, if it's in terms of an athlete, on the field side. It's a sport concussion assessment tool that is typically used, but there's often other follow-up tests that are done to elaborate on that.
How often you see concussion in your practice?
In my practice, with my caseload at this point in time, approximately 20%.
20% of
20% of patients.
So how many patients a day probably?
15 to 20 typically.
Okay.
So usually I'm seeing.
So what will be the number
2.
of concussion cases across say, Canada?
Number of concussion cases across Canada, I think it varies depending on the region.
Yeah,
It
but
also
there might be quite a few cases, especially with the young student,
absolutely
with the high impact sports injury.
high impact sports, as well as in the motor vehicle industry
Yes.
as well too.
Yeah, right. We'll take a short break and we'll continue our discussion.
Thank you.
Thank you. Please stay back for the next part. Welcome back to the show, Talk with Your Doc. And today with us is Jason Taddeo, who is a physiotherapist, and we are talking about concussion. Jason, you were mentioning about the number of incidents of concussion are going up, and as we are detecting them, even with the different methods of criteria used for the diagnosis, and it can be caused by high impact trauma as well as non-high impact trauma can also cause concussion. So tell me, how long does the symptoms of concussion last?
Well, statistically, most concussions or most concussion symptoms will resolve within a few days, typically up to 2 weeks in the adult, sometimes taking up to 4 weeks in the adolescent.
So if somebody has those symptoms and the symptoms will be there for some time and patient doesn't go to the doctor, what happens then?
Well, often the symptoms simply resolve and they return to sport, and some patients aren't even aware that they have been concussed. But again, if you're experiencing something different in terms of sensation, whether it's physical sensation, how you feel you're thinking, balance issues, headache, after an injury, anything that feels different than your normal, there's a potential you may have suffered a concussion.
So, what is post-concussion syndrome like?
So post-concussion syndrome is a little bit debatable in the literature in terms of when it begins and what really defines post-concussion syndrome. Essentially can be thought of as any type of symptom that is persisting as a result of concussion beyond 4 weeks post-injury. There tends to be some overlap with other disorders such as chronic fatigue, depression, or vestibular inner ear issues that might have resulted from the injury or might have been pre-existing in the patient. So because of that overlap, it's often hard to diagnose.
So what happens in that period after 4 weeks?
So after 4 weeks, patients will often experiencing some of the same symptoms that they experienced initially, which may be headache, again, difficulty with thinking, problem solving, multitasking, sensitivity to stimuli like lights, sounds. They may have personality changes that are evident to them or their loved ones. And post-concussion syndrome tends to be diagnosed if at least 3 or more of those signs are present, as well as if there is no alternative diagnosis to explain the presentation.
So somebody has a concussion and his symptoms resolve and he go back to the injury sports and has another concussion now. So what happens if somebody doesn't treat himself or doesn't go to the doctor after repeated concussion?
Well, after repeated concussion, particularly in the adolescent now, there is more literature to show that repeated concussions without proper assessment and management can lead to long-term damage. And that damage, again, we don't have wonderful long-term studies out there to show, but there are some moderate-term studies out there that may show changes to the brain itself. We may see changes to the physical structure of the brain that then become evident on imaging. And I say that because initially after concussion, our typical scans such as CTs, MRIs are often negative. There is nothing showing on
investigations are normal.
Not at all. There's some investigations such as SPECT assessments that are coming out, which are CT assessment techniques, which may show changes in blood flow in the brain. However, often those special tests, those gold standard tests, come back negative. And that's why it's so important to look at the patient, look at the subjective symptoms that patient is telling you they experience after concussion, and the physical examination after injury to diagnose concussion.
So repeated concussion, long-term injury can lead to, like, say, behavioral changes for difficulty in concentration or loss of balance, something like that?
That's right. Permanent changes, potentially.
Those will be long-term.
They can be long-term. Very similar to other mild traumatic brain injuries, such as a minor stroke.
Just like it's lasting for a longer period.
That's
so
right.
At what point should they stop having the sports?
Well, it's a difficult question to answer. Typically, high impact, high risk sports should be discontinued with repeated concussion, and if the symptoms are not resolving. So symptoms that tend to present when a patient engages in a sport, say they start to run and they get a headache, they should not do that activity for at least 24 hours before they attempt it again. If they experience a headache again they should be not performing the activity. If they're returning to sport and they're still getting some concussion symptoms, there is the chance that they've returned too soon, and that if they sustain another concussion can create more permanent damage. And as you said before, there is a higher consciousness paid now towards repeated concussions and the link with long-term complications and even death, which is in the literature as second impact syndrome.
Do you recommend any investigations, any laboratory test for a patient of concussion when it comes to your clinic?
Well, I think like any injury, we have to look at the cost benefit of all of those special investigations as well as the circumstances of the patient. So just like an x-ray isn't appropriate for every patient presenting with signs of osteoarthritis, an MRI or CT isn't appropriate for every patient presenting with a particular criteria or suggestion of concussion, simply because we know it is often going to come back negative, and it's not a well use of that patient's time nor the healthcare system dollars. So that's where, again, the physical assessment by an appropriate provider who is trained in concussion assessment comes into play, and we can often save a lot of those investigations. Now, that being said, if there is a high-risk patient coming in where there are signs such as convulsions, seizures, if there's suspicion of a hemorrhage or skull fracture after impact has occurred, absolutely, investigation is needed. That's a medically emergent situation and needs to be attended to. But just in terms of average, and I hate using the term average because every concussion is very different, concussions, it's not necessary to go through sophisticated
imaging.
imaging.
They are not required. Just clinical examination is more than enough.
Typically, yes.
So what is the treatment of her concussion then?
So treatment tends to be based on a stepwise algorithm, and it's very patient specific. There's no recipe that's out there. It's matched to that particular patient, their signs, their symptoms, their physical abilities, and their goals. So when we look at the team, it tends to involve a team approach, which is often the medical provider, whether it's the family doctor, concussion specialist, or pediatrician, often physiotherapist or other healthcare providers such as chiropractors. We may also see involvement of speech-language pathologists or occupational therapists working on the cognitive behavioral side, and even the psychotherapy aspect to treat other associated signs or symptoms such as depression.
So what is the role of physiotherapy in concussion? How does physiotherapy help?
So in my particular practice, again, it's very specific to the patient sitting in front of me. So one patient who may have an associated injury to their neck when they were concussed, say from a whiplash type event, we may be doing certain treatments directed at their neck for strengthening, mobility, and muscle control or motor control. Typically it involves a component of balance training as well, and often involves vestibular training, which is essentially training for balance, but often with more of an inner ear focus.
How long is this treatment?
Very dependent on the patient. Often we're seeing patients for at least 4 weeks after concussion, if not 2 to 3 months. Patients we find that tend to come to us more from the motor vehicle accident lens often are coming in later for different reasons, but often that concussion maybe wasn't identified early on if the patient had fractures and other very emergent conditions that required treatment, and the concussion may have been not forgotten, but the concussion may have been not as a priority compared to some others initially. So often patients with motor vehicle accidents will come in with a concussion with some of those long-standing symptoms 6 months, a year, 2 years after injury.
So patient having concussion first goes to the doctor and then he refers them to you?
Typically, yes.
Yeah. We'll take a short break and we'll continue the last part of the discussion. Please stay back for the last part. Welcome back to the show Talk with Your Doc. Today we are talking about concussion, and Jason Taddeo is guiding us about it. Jason, you were mentioning about high impact trauma and concussion, and we were mentioning about the role of physiotherapy. That patient goes to the family doctor and then family doctor refers them to you. After the treatment of about 8 weeks or 2 to 3 months, what happens next then?
So in many cases, the symptoms tend to dissipate on their own over the course of therapy. That patient will return to sport, return to their normal activities, and really our role is minimal at that point if we've done our job and we've educated the patient to watch for abnormal signs and ensuring that they're achieving their goals. But typically they're following up routinely with their family doctor, or if there's a concussion specialist involved at that point, just to ensure there are no long-standing issues. And we act more as a resource at that point. So we're not actively seeing that patient, but we're always there if needed.
So symptoms resolve? Is that what happens?
In most cases, yes. In some cases where there tends to be more of an injury to the nervous system, 2 to 3 months isn't a long time in terms of recovery for the nervous system. So sometimes we will monitor that patient monthly over the next year. Yeah.
Now, do the patient go back to the sports? Can they go back, or when do they go back?
And typically return again is when symptoms are not produced with a sport. So if I'm treating a runner and they start running and 10 minutes into their run they experience a headache, We may adjust their training so that they're still able to run, but not to that threshold where they've had symptoms. And often attempting return to sport with patients is very, very needed in developing a treatment plan, because we want to see what activities elicit symptoms. We want to see at what intensity they have to be to bring on those symptoms. And then we adjust our treatment to match their goals. Again, like I mentioned, there's no recipe format to treating the patient, so we really have to have a good open communication with the patient to find out what they're feeling, because they will ultimately guide their own treatment. We just have to be there to listen.
Right. Now, what can be done to prevent the concussion? Like, should there be helmets or any other devices can be used?
Yeah. So from the literature, and again, this answer may change 10 years from now with more research, there's really nothing when we look at the major systematic reviews and analyses out there to say that one particular type of protective equipment is better at preventing concussion. So mouth guards, for example, we know mouth guards are excellent at preventing dental injuries or minimizing dental injuries and facial traumas, but there's really nothing to show in the evidence concretely that a mouth guard will prevent concussion if the impact's going to occur. Same with helmets. There are some amazing biomechanical helmets out there, but in terms of the research, a lot of the research has been done by those particular product manufacturers, and it may be very well great research, but when we look at the concept of a protective helmet as a whole, we can't say 100% that it can be concussion can be prevented with a helmet, for the very reason, the Jello analogy that I used when we were talking. While the helmet may contain the head, it may dampen some of the forces being transmitted to the brain. Even without a direct head injury, the brain is a mobile structure within the skull, and it is susceptible to damage even when you're wearing a helmet. That helmet may be on, and you may get a whiplash, not hitting your head, and still sustain a concussion.
Now, in the children, especially the pediatric age group, when they have a concussion, and sometimes the children, they don't even report that they had a concussion. How does the patient or parents would come to know that the child has to be taken to the doctor?
Well, any suspected head injury to the child, whether it's impact or not, or if the child is reporting that they feel different or they have a headache after an injury, should be reported. Ideally to the family doctor. If it's emergent, definitely the emergency department, or if they're following up with the pediatrician, make sure you're accessing a gatekeeper for care.
Right. Now, is there any particular sign and symptom particularly in the pediatric age group one should consider as an emergency?
Well, again, symptoms that are worsening. So if a child has sustained a concussion and they've experienced headache, for example, or some balance issues, that is immediately concerning. But if those symptoms or others are worsening over hours to days post-injury, if they're experiencing seizures, convulsions, frequent episodes of vomiting, those are, or any behavioral issues that you as a parent are noticing are very, very odd in your child, you should be concerned.
Okay. Now, a child falls down and doesn't lose the consciousness, just has impact. What should one do next?
And that's very important, because a number of people do believe that loss of consciousness is required to have sustained a concussion, and that in fact is false. Loss of consciousness is absolutely not required. So in that case of a child who has fallen, not injured their head, the child should be monitored definitely by the parents to see what the symptoms are like, and if they are worsening. If there's any concern, by all means access your medical provider. But again, just monitoring the child, ensuring that they're not returning to sport before they are assessed by an appropriate provider is absolutely important in minimizing consequences.
Right. So to summarize, concussion, it can be because of high impact or may not be due to high impact trauma to the head. And it is very important that we go to the doctor, family doctor or pediatrician right away, right?
That's right. And there are a number of concussion specialists available depending on which area you're in to access as well too. So knowing what resources your community has available is very, very important.
And preventive aspect includes helmet or mouth guards, but they not necessarily are going to stop the concussion.
Correct.
So even with the helmets, if you have a head injury, go to the specialist and get it done.
Absolutely. Right. Even when we look at the automobile industry, with the implementation of seatbelts, Seatbelts have saved many, many lives, but we often do see an increased incidence of concussions afterwards, because now those patients that have successfully survived that accident may actually be presenting with concussion or other injuries that we previously wouldn't have seen. So protective equipment is absolutely essential, but it is not 100% preventative.
Protective, yeah.
That's right.
So one should be aware of this entity and get a treatment as soon as possible.
That's right.
Otherwise, it can lead to long-term damage. Right?
That's right.
Thank you, Jason, for coming to the show. Really appreciate your time.
Thank you for having me.
Thank you, everyone, for being part of the show.